So, Tanir, we've been talking this whole time and we've just kind of been touching the surface on data, but I want to just maybe go a little bit deeper there. I know we're thinking very deeply about data, how to use the data, how to make sure it's misinterpreted, provide context, but how are you all thinking about data and what do you think the future of equity data and EMS looks like?
It's a great question, a big question. And in spite of the fact that I'm very aware that equity work isn't linear, I'm going to sound linear for just a moment because the way that I think about the importance of data is it's like the fundamental starting point for any real change that you want to make. It's very difficult to change something that you don't fully understand. Not where you're at and not where you're going. If those two things aren't really clear, it's going to be really hard to make the change. And so data, just what we put into systems and what we can pull out of them is so important to get to the next step in this journey of then, okay, knowing where we're at. How big is that problem? Is it a problem? I don't know. And if we were to call it not a problem anymore because, gee, we've solved it, what would that look like too? And in order to answer any of those questions, we need to have good data, clean data, consistent data across systems, across the state. All of the inputs need to be vetted, consistent, and monitored. And I know that is exactly, I'm speaking your language, singing your song, and talking about your journey. We know that's true. So from our side of the table as a funder, we're always thrilled when folks come to us with a deep understanding of and some humility around their own data practices and just knowing that we could do better. We may not disaggregate. We may not collect everything we need to. We'd love to have more. So we love seeing projects like that. And, I'll turn it back to you because when you talk about the whole data spectrum, we love, and that totally resonates with us too. Tell us a little bit about your data vision.
So we kind of have a big data vision here at EMSA. But like you said, it's very difficult to justify any progress forward in any area if you don't have this baseline assessment maybe, or this baseline truth. I think the way that we say it here at EMSA is, what can you assume to be true? And right now it's really difficult to make any true assumptions about equity in EMS because we don't maybe have all those pieces put together yet. But I think, we kind of have this tiered thought process around data. So we have the California EMS information system, and it's really collecting so much patient care data and what that looks like. And we have our central registry system that's collecting all the licensing information and, everything about our workforce. And then we have, we are standing up, right, the PULSE registry, physician order for life-sustaining treatment, and really respecting end-of-life care wishes and making sure that our providers have those in hand, or anyone who needs them has them in hand to respect those final wishes. And so I think it's first making sure, as you astutely said, clear, consistent data statewide, universally understood, really building, that's kind of our foundation, right? Is really building 100% compliance and a really strong data dictionaries around all of those so we can perform these kind of apples to apples analysis that we need to do this baseline assessment. And then I think you have these kind of, the next tier is really then, how do you integrate that data? How can I have these golden records or universally understood where I can cross-reference data from the central registry with ChemSys and have an even more, right, complete picture of maybe what transpired at this larger level. And then I think it's, if this is our home, right, these three databases are our home, and we then are able to achieve integration, how do we get information from our neighbors, right? How do we get information from hospitals, trauma centers? How do we get information through the HIOs and make sure that now we've integrated and have a little bit more of a complete picture? And then ultimately, right, you want to get to a place that you can achieve predictive analytics. ultimately, we are in a very reactive state right now. And so we are having to do a baseline assessment, create policy, and do all these things. But if you had this data integration, you could actually predict and say, we see that these 4 factors are occurring. If this ambulance service, who maybe is not, it's not fiscally sustainable or is being annexed or whatever it is, we now know that this is going to have 1, 2, 3, 4 impacts. Now there's a change in a service delivery model. Let's wait and see what happens. And I think we want to move from a reactive to a proactive. And I think our local partners want that too. And the data is the key to those building blocks to get to predictive analytics, where you can predict the future of that community in a finite way, or at least be able to acknowledge there is a 60% risk of X occurring if this hospital shuts down, whatever the metric may be. And I think that's the state we want to be in. And so, I think this is really, and a lot of that has to do with equity and accessibility. If you can do these predictive analytics, you can close gaps before they even tear open. So it's a big data vision, and I humbly recognize that. And it's a lot of work to get there, but I don't think there's anything more worth it if you can close a gap before it even opens.